Everyone knows about the three magic words, I love you. Sue Hoyt played a key role in translating those three magic words into three magic numbers that in important ways mean the same thing. When trouble becomes emergency, even the smallest child is trained to dial 911. It wasn't always that way. There was a time when different states had different emergency protocols.
A House Commerce Subcommittee is considering legislation to further deploy and upgrade 911 capabilities and functions.
But long before her testimony helped secure passage of the National 911 bill, Sue Hoyt loved trauma. That isn't as strange as it sounds. Her career as an emergency nurse practitioner and the passion that forged it began as a patient. The fifth of 11 kids in a rambunctious family, she was playing with her brothers and sisters when she took an accidental baseball bat to the forehead. Somewhere in the resulting black and blue and blood, Sue Hoyt found a faith in the people taking care of her. An emergency nurse practitioner was born. Hoyt would become not only a voice, but also a force for the role of nurses in healthcare in general and emergency care in particular. The former president of the Emergency Nurses Association applied yet another talent to the organization. She is co-editor of the Trauma Core course taken by more than 500,000 nurses worldwide. She was the architect of a course for emergency nurse practitioners that directly led to recognition of emergency nursing as a specialty by the American Nurses Association. Nothing is truly a gift unless it is shared. Hoyt served as director of USD's Master's Entry Program in Nursing, recruiting and encouraging registered nurses to pursue additional training. And not just in emergency care. In a healthcare landscape consistent only in its change, her work has impacted the careers of countless nursing professionals, and by definition, most importantly, exponentially more patients. Hoyt continues to pursue her passion as an emergency nurse practitioner at one of Southern California's busiest and most prestigious hospitals, St. Mary's Medical Center in Long Beach. She also makes the time for her own large family. Hoyt and her husband Ken live steps from the sand in Imperial Beach, where a new passion is flowering, an entrepreneurial venture already christened Susie's Succulents by the Sea. If past is prologue, the succulent industry, like the nursing profession, is in for a sea change.